On this free webinar, Dr. Delicia Haynes, local family physician and founder of Volusia County's first direct primary care clinic, will show you how to increase productivity and retention while controlling costs with a powerhouse primary care program for your employees. Our presenter for today is Dr. Delicia Haynes. She is a University of Kentucky College of Medicine graduate. She earned a Bachelor's of Arts in Biology with a minor in Spanish from the University of Louisville. She also completed her training at the Halifax Health Center for Family and Sports Medicine residency program, and she has completed additional training in aesthetics, laser cosmetic procedures, physician-supervised weight management, and is a certified health coach. Dr. Haynes is very active within the Daytona Beach community as both a physician and a resident for 10 years. In addition to practicing medicine, Dr. Haynes is also an award-winning coach and business mentor. So let's hand this over to our presenter, Dr. Delicia Haynes.
Well, thank you, Desiree. First, I just want to acknowledge you all for taking the time to be here with us and listen to this. I know that business owners' time is extremely valuable. So I know that the fact that you're here and you're engaged means that you really understand how important your employees are to the health of your business, and you really appreciate your team. So you're people like myself who started a business because I had a gift to share and skills, and I wanted to share those with the community. And I really appreciate the people who work alongside me day in and day out to really carry that vision forward. And that's exactly the type of business people that I enjoy serving. So when I was growing up, I knew I wanted to become either a doctor, a teacher, or a lawyer. And the teacher in me loved being a part of those light bulb moments for people when everything just kind of clicked. I also enjoyed advocating for people, especially the underdog. And I was absolutely fascinated by the human body and how systems functioned. So I became a doctor, and I get to teach medical students and residents and my patients. I get to advocate for my patients, and I get to heal the human body every day, so I'm really kind of living my own dream. My personal health philosophy is that true medicine comes in more than a pill form. So I'm an advocate of lifestyle medicine, and that total health philosophy really permeates everything that I do as a primary care physician, because primary care is crucial. It's so important. When we look at 90% of health costs, and we trace them back to the root, 90% of those health costs stem from chronic disease. So diseases that you guys are all familiar with, high blood pressure, diabetes, cholesterol, diseases in that realm. And high-performing primary care is the specialty that's uniquely situated to meet this need. So we've been serving individuals since 2009, and in today's environment, businesses are shouldering more and more the responsibility of paying for health care. So we created Healthy Employees as a solution to providing high-quality, cost-effective care for 80% of the issues that send people to the doctor, because that's what primary care physicians do. Healthy Employees is a business-to-business relationship between an employer and a high-performing primary care, which allows an employer, regardless of their size, to offer enhanced primary care on behalf of their employees and to ensure that the bottom line experience for the employer is intelligently managed. And that's really something that health plans don't do or don't do very well. I get asked a lot, what's the difference between direct primary care and kind of a typical primary care office? And I think the best way to articulate that is that direct primary care doctors, we tend to have a very different mindset about our role with the patient. So it's a much more animated, patient-centric, kind of patient advocate role. So you won't hear us saying things like, we don't have time to do that, or we're not paid enough to do that, because tending to the patient is paramount, and the patient's interests are the only interest in the room. We're not checking forms for insurance. We're not having to negotiate with those third parties. And it's important to realize that really nothing happens to a patient unless the doctor orders it. So whether it's a $3 test, a $300 prescription, or a $3,000 imaging study, it doesn't happen unless a doctor actually orders that. So in working with the business, what I do is I kind of help to serve as a secondary purchasing agent and really eliminate unnecessary spending in medical waste. And I do that by negotiating with specialists or knowing more cost-effective treatments. So when I say medical waste, I don't mean biohazard or things that you throw away. I mean tests and procedures that may not be relevant to the patient in a particular situation. Because what we're seeing a lot in medicine is that in an effort to improve efficiency, healthcare is resorted to using a lot of forms and checklists. And as a physician, you just find at the bottom that everything on that page magically gets done. And while that type of automation is touted as being a model of efficiency, it's really not always effective, and oftentimes it can be a source of waste because every single thing on that page has a cost, and you may not need everything that's on that page. So one of the things that I do is go through and question or cross out anything that doesn't serve you and fight for what does. So we carefully examine what a hospital may deliver or what a specialist may suggest to see if this is something that's really necessary or if it's more of a pre-planned scripted protocol. And we also identify high-quality specialists who can offer a service at more competitive rates. So I represent the interests of a patient and an employer, and I've got both the time and the interest to protect them from unnecessary care and unnecessary costs and help businesses make the best use of your healthcare spend. So high-performing primary care is a cohesive set of team members who work together in advancing the highly customized care plan of the individual so we can prevent the downstream complications in spending that would warrant the use of a catastrophic type plan. So it really led me to look at kind of what is insurance really meant for. And the thing that people are really concerned about with insurance is that they're going to have something happen to them that would bankrupt them, that would be catastrophic. So these are the typical types of insurances people are accustomed to, and we know that when it comes to life insurance, it's great for your beneficiaries. When we look at kind of home and car insurance, if you look at car insurance especially, you don't use that or homeowners insurance for basic problems. So if you had a door ding or an oil change, you wouldn't use your car insurance to pay for those types of problems. You would use your car insurance if you got into a terrible wreck or had some kind of catastrophic injury. And so it really leads us to question, with health insurance, if we're following the basic tenets of insurance, why are we using our insurance for primary care? Why are we using it for sinus infections, for controlling blood pressure, for diabetic medications, for well-woman exams? Why are we using our primary care for that when all of that is really more in the preventive side? So it's really more on the level of kind of the oil change and the prevention than it is on catastrophic. And then, why wouldn't we just make sure that we have insurance for things that are catastrophic or for things that are above that level of prevention? So what is direct primary care? It's the fastest growing movement in primary care, and it's really a direct relationship between the patient and the doctor. It's a membership-based model, so all of the patients are actually members of the practice, and it's extremely patient-centric. So that makes an ideal solution for employers because it has high customer satisfaction rates, 92%. It helps to really control costs, and it's an incredible value because we know how important primary care is, and especially high-performing primary care. So what we've got now is kind of this mess. So there's this relationship between the patient and the doctor, but there's a lot of things that are in between. There's no transparency. If you're trying to figure out the cost of something, it's extremely difficult to do that. And all of those people in the middle and those hospitals and the billers and everything, all of those costs are being supported by the doctor-patient relationship. So it's really that relationship that has to pay for everything, which increases the cost of healthcare. So with direct primary care, it's really about kind of cutting out the middleman and making the doctor directly accountable to their patients. So there's no one in the way between you and your doctor, and the only person that your doctor is serving is you. One of the geniuses and the beauty of direct primary care is the simplicity of the business model. So if you take kind of the genius of the gym, you're a member of the gym, and for your membership fee, you're able to come in and use whatever equipment that you need. And direct primary care works very similarly. So there's kind of a membership fee in the background that's automatic. And whenever you need to come in, whether you need to come in for an EKG or a spirometry or get your blood pressure, get your labs drawn, have a visit in the office, or maybe a virtual visit where you don't come to the office, all of that is included in your monthly membership fee. So it's a very simple and straightforward business model, and it's very transparent as well. Some of the features of direct primary care, so you get longer one-on-one time with your doctor. My average office visit is between 30 and 60 minutes, where the national average is about 7. 24/7 ability to communicate with the doctor's office. You also get virtual visits with the doctor, so you don't necessarily have to come into the office to have a visit. Oftentimes, one of the best things I provide for people is peace of mind. We'll have kind of a healing conversation, and that can be done through web chat, kind of a Skype-like. It's not Skype, but it's a very kind of a Skype-like kind of interface. Or people can also come in. Special rates on services and lab tests. Actually, the basic labs are actually included in our membership because we really want to encourage people to be able to diagnose things early and to really start taking care of people and prevent that downstream complication. And it helps to eliminate barriers because when people don't know how much the basic labs and things like that are going to be, they sometimes delay getting them done. We offer same or next day appointments, and then we also offer a wellness plan. So it's not just that symptom suppression mode of medicine. It's really about taking the time to get to the root of what's going on and help people actually get healthy and stay healthy rather than just seeing people when they're sick. So we talk sometimes about 3 health wishes and 3 health fears, and really serve as health coaches and help people to kind of walk away from move away from their fears and move toward their health wishes. With the wellness program or the wellness plan, as a company, you also get an on-site wellness presentation. So the way that we typically do that is we'll look and see if you have like claims data and we know what diseases have been the most expensive for your company. We can kind of look at that and then develop a wellness program that's really specific to your population. And we do that kind of on a larger scale, and then we also are working one-on-one with individuals to make sure that we're really protecting and improving their health and optimizing their health. One of the great things about direct primary care is the value and the convenience. So there's a lot of use of technology. It's that doctor-patient relationship from the days of general practitioner, but also using the technology today to make things even more convenient for patients. So it's really time to kind of reimagine how your doctor's visit goes. Do you have to take off work, come in from the lake, sit kind of in a crowded waiting room with people who are coughing, deal with a staff that might not have the best customer service skills, and kind of are sitting behind that bulletproof window? Do you have to wait for an hour for a 7-minute appointment and feel like more of a copay than a person? Or can you have that same experience from the comfort of your own home or from your office? So that's really what the things that direct primary care allows and the technology allows, is that your health care can be done on vacation, it can be done at your home, it can be done in your office, it can be done in a way that's more convenient to you and to your lifestyle. So direct primary care is growing because it works. So this information is from Q-Alliance, which is a direct primary care practice in the state of Washington. And back in 2010, they did a study where they were comparing direct primary care kind of with traditional care. And you'll see in that top section, basically across the board, patients of direct primary care experience fewer admissions to the hospital. So how does that translate into savings for you? Well, the average hospital stay is around $2,000 a night. So if you can prevent, one of those, especially if you're a self-funded company, that really helps to improve costs. And then down below, additionally, the members who are readmitted, 97% less frequently for a heart attack, 95% less frequently for congestive heart failure or CHF, and then 91% less frequently for pneumonia. A little bit more about the effectiveness of direct primary care. Patients who are members of direct primary care practices, they have fewer ER visits. So you can imagine if you've got more access to your primary care physician, that really helps to cut down on your use of the emergency room. When they were admitted, they had fewer inpatient days, so they got discharged earlier. Fewer specialty visits, fewer advanced radiology, all while increasing the number of primary care visits. So when you are coming in, you're more engaged with your primary care, that really helps to cut down on the other kind of the use of other specialists. So this is actually from our website, and it shows, what we offer, which is 3 levels of peace of mind, and we're talking mainly about healthy employees. We've been doing some individual programs in the past. We've had the Premier Concierge, which is that 24/7 doctor on demand since 2011. And in 2015, we introduced Access Wellness, which is a direct primary care type program. And what we've rolled out more recently is Healthy Employees. And that gives the employer, it's really an employer-sponsored version of Access Wellness. And it includes that corporate wellness presentation that we were talking about. So a little bit about the membership services. This is also from our website. And everything is completely transparent. You can go there, find out how much everything is going to cost. And you'll see that it includes all the visits. So whether those visits are live in person or they're telemedicine visits, those are provided without any additional fees. All the procedures that are listed there are included. In the middle section, you'll see about labs and tests. So urinalysis, EKGs, spirometry to check lung function, CBC to make sure that you're not anemic, a complete metabolic panel which would show like your electrolytes, kidney function, liver function, and if you were diabetic or pre-diabetic, cholesterol, thyroid, all of those things are included with your membership. And then things that are not included with the actual membership, we work really hard to negotiate to get to wholesale rates. So you'll see that there's a section there talking about prescription medication, and we've negotiated with the pharmacy that helps to get prescriptions at 50 to 90% savings. And then on the far side, you'll see under radiology some of the the pricing listed there. So an MRI, for example, MRI of the neck of the cervical spine, typically around $300. Typically around in the thousands, and we get it for $300 for our members. So those are some of the negotiated rates that we've been able to do, and then pass on those savings directly to our patients. So there's complete cost transparency. So this slide shows really kind of what everything is. And again, it's available directly from our website. So we've got at the top the pricing for individuals. And then we also have really created everything with our families in mind as well. So we've got a couple plan, a 2-parent family plan, and also a single-parent family plan. And you can add additional children to any of the family plans. So a few examples. So this is a 42-year-old guy who used to have a gold plan, which he was paying $363 a month for, plus copays. And he was able to switch to a direct primary care plan, which was $77 a month because of his age. And he coupled that with a bronze level plan. And so his total came down from $363 to $268. And he also is no longer paying copays for routine care. So he was saving, $95 a month, which is a significant saving. And then if we kind of take that example and we expand that across an entire organization, you can see that if you currently have kind of a gold level annual premium of about $5,000 per year per employee, and you change to a bronze level annual premium with a direct primary care program, and we know that by itself a bronze level plan may not be considered a very good insurance by your employees. But when you're able to add that value from our direct primary care, now you've got a fantastic benefit. And so the price of that dropped down to $4,000 a year per employee, with a savings of $708 a year per employee. Plus, your employees don't have any out-of-pocket costs for most of their medical care, because every time they come in, it would be completely covered with their membership without them having to pay for additional fees. So it's really about meeting your needs, because no two businesses are alike. And some of the benefits to employees, care that's really cost-effective, care that's very effective, and has a really high patient satisfaction rate, again, 92%. And then care that's convenient and accessible. It's all about being there for the patient and making things really convenient for the patient, making sure they get what they need. And then as a business owner, experiencing those reductions in cost. So there's a cap on how much your primary care cost is going to be. So you'll experience those reduced costs on tests and screening, really get to decrease the number of ER visits and sick days and hospitalizations. So you're keeping employees out of the emergency room and out of the urgent care and keeping them in your business and keeping them at work. And if they do get admitted, having a reduction in the number of hospital days. You'll also get enhanced and increased access to primary care services. So direct primary care is really that high-performing type of primary care. And note the knowledge that 80% of the needs of your employees are going to be covered by their primary care doctor, which creates incredible peace of mind. Also, this emphasis on wellness and keeping employees healthy and keeping them, happy and working. So this also translates into, kind of revenue for you because of increased productivity. So people that are feeling better, they're feeling more supportive, they're healthier, are able to be more productive and creative at work. And so you can experience those reductions in absenteeism and presenteeism and really create a healthy environment where, where everyone thrives. So whether you're looking for a more affordable benefit plan, or if you're looking to offer kind of a vestibule to your current benefit plan, you can provide healthy employees coupled with like a minimal essential coverage wraparound plan as one of those options. And studies really suggest that employees really like having options when it comes to their benefits. And then if you're small enough or you have a lot of part-time employees and you're under that 50 full-time equivalent threshold, you can use actually this model in place of a benefit plan. So for the employer, it really improves your profile in both the minds and eyes of your employees, which is going to help you to both recruit and retain talented individuals. Plus, you get a channel to me to share your concerns regarding the health status of your population, which allows me to then have additional information about work life that impacts their health. Because not every business can create kind of a utopic culture of wellness at the expense of their business interests. There are some environments that are just inherently a little bit chaotic, very busy, and while we can make some changes in those environments, we may not be able to really. Sometimes it is what it is. But what we can do is I can add programming and services and coping strategies that really help your employees to work most effectively in whatever environment they may find themselves in, and then prevent those downstream spending that would warrant the use of a catastrophic plan. So I'm sure that by now you can really see the advantage of having that business-to-business relationship with high-performing primary care. And as a business owner, I know how important it is to continue seeing your mission go forward through your business. So I'd really like to invite you to invest in yourself by investing in your team and joining with us to create a culture of healthy employees and thriving businesses. That's really what it's all about. It's making sure that businesses are supported, they're getting what they're needing, and they're really thriving in this environment. So one thing you may notice on this slide is that the phone number there is actually not the general practice number. This is a dedicated line to a special team member that's really just for you. And I would love to have the opportunity to sit down with you or talk to you and really find out the goals of your company and see how this can be a solution. So if you go to our website and you go to, it says Healthy Employees, and you scroll to the bottom, you'll see this this section of the screen and that button where you can either click to schedule your opportunity analysis today and input your information, or you can just call us directly or email us directly, and we'd be really happy to really kind of work with you and see how we can be a solution. So with that, I really just want to thank you again for your attention and for your interest. And I think we're ready to kind of open it up for any questions that you might have.
This is a very interesting presentation, and I have quite a number of questions, and hopefully one at a time. One of the things that comes to me immediately is, Dr. Haynes, what is your criteria for business owners as far as to how many employees they have to have in order for you to be their preferred primary care physician? And question number 2, among 10, it's does this cover mental health?
Did you say does it cover mental health?
The first one has to do with the criteria for business owners, how many employees they must have, and part B is anywhere in here where mental health issues are covered, and I'm supposed to do through referral, but anyway, it's one of my questions for now.
Okay. Well, thank you for the questions first. So in terms of the number of employees that a business has, there is not a limit. So this is something that can be used both for small businesses and for larger businesses. And we know that the landscape in terms of whether a business is going to a business who has to worry about kind of the Affordable Care Act. So there's the smaller businesses who are less than 50 full-time equivalents. They do have a lot more flexibility in terms of either using this as a full benefit, whereas the businesses who have over 50, if they want to be compliant, would need to have a kind of a wraparound plan that meets that minimal essential coverage. And we work with insurance brokers who really help businesses to find a really nice wraparound plan that would work with the membership. But there is no kind of number criteria in terms of how few or how many employees you can have. It's a great opportunity for larger employees because we can really kind of make a dent, come in and look at what diseases you're spending a lot of money on and how we can, kind of work to change that both on a large scale and then on an individual scale. And then it's also great for, a smaller business, especially because oftentimes smaller businesses are competing with larger businesses and they can't really offer that same level of benefit package. So when you can offer, this type of service, this type of primary care, it really helps you to stand out and compete better so that you can really retain those talented individuals. So there's really no limit there. And then as far as mental health, yes, indeed. So, primary care does include, aspects of mental health. So one of the most common things that I treat daily, and one of the things I'm really passionate about treating, is depression. And, that's one of those things that it's kind of like the common cold of mental health. So, and there's been a lot in the news, recently about, mental health parity and that sort of thing. And so it's very important to us to look at someone's total health, which includes their mental health, their emotional health, their physical health, and a lot of other factors. So I don't really segment mental health outside of health. It's really, it's really more integrated, and it is included.
Okay, this is excellent. I love the point that you made regarding the smaller businesses versus the bigger businesses, that it gives them a better opportunity to compete in the way of employee retention. And you made it clear that it doesn't matter how big or small the business is as far as your criteria is concerned. So you take what is as is. Did I understand that correctly?
Yes, that's absolutely right.
All right. Okay. I've been reading a lot about the new technology and telemedicine, and in as much as I have a pretty good grasp of what it all means, when it comes to explaining it to my employees, for example, that the benefits of technology and telemedicine and the digital wearables and what is a must with employees, how does it all work, and what is the reporting process from you, the doctor, back to the business owners? What is the process that you have in place to do that?
Okay. So one point that's really important is that, although the business owners are they're sponsoring this on behalf of their employees,
Mm-hmm.
they don't have access to their employees' personal health information.
Gotcha.
So that's a very important kind of privacy distinction. And that's why it's important that when they were doing like the health programs, the reason that they had to keep it so kind of painting with broad strokes was because really an employer, there's certain things that you maybe shouldn't know. So I'm really I'm working on that individual level. So what I do talk with the employer about is I allow the employer to talk to me about their concerns with their population. And we don't give any specific information on any individual or that sort of thing. What we can do is look at kind of like like the claims data we talked about before, and that's public knowledge of knowing what the business is spending a lot of money on, and create something for that. But we do really make sure that we really respect the individual's privacy, and that's why it's so important that we are kind of not we're not an employee of the business. That we are that we are seen as being separate and there for support. Your other question about kind of the wearable devices and the technologies and mobile health, and I really think it's about convenience and about engagement. So patients a lot of times just want to have a conversation with me. And oftentimes when I want to follow up with someone, I want to see them, and it doesn't necessarily have to be that they're having that, they're taking off work and traveling down here and, coming in to physically see me, because a lot of times we can do those kind of easier, more simple visits in a virtual fashion, and then reserve the exam room for people who are, really sick and really need to be kind of, managed, and we need to lay on hands and that sort of thing. So the convenience part, and then engagement, it's up to the individual if they want to share their wearable device information. But if they do, then obviously we can kind of encourage people if their goal is weight loss. We can see how they're doing it with their activity level and with their weight. If it's sleeping, better, we can kind of see how they're doing with that. And my staff also serves as health coaches, and so they really help to kind of help people move along with their goals and with that accountability.
Okay, that's excellent. If I want to talk to you, let's say I become a client and I want to talk to you at a certain specific time of day or night, and now I'm talking about if I was an individual patient of yours, and we're talking about telemedicine and accessibility 24/7. How many other doctors do you have that will back you up when you are probably busy with someone else at the same time? How does that go? Or do we go on queue? Walk me through the process.
Right. So even if it's a virtual visit, we still have an appointment time. So so regardless of whether you're physically coming into the office or we're setting a time to speak virtually, it's still an appointment. So we still kind of we hold that space regardless of whether it's in person or virtual. Our virtual hours can be more extended, because oftentimes you can just be dealing with me, and it's not so much kind of coming in and interacting with the staff or the team as much. If I am out, I do have physicians that kind of help me and serve as backup. But oftentimes, when if I'm in the continental U.S., I can still do telemedicine visits. So I still will kind of help people out in that regard. But we treat it like an appointment. So you know what time we're expected to sit down and talk, and I know what time. And especially if we're going over something like your lab results, we're going to make sure that you have a copy of that beforehand, that kind of you're, maybe at your vacation spot and you're looking at your labs, and I'm here, and we're kind of going through one by one each and every one of them as if we were sitting together.
That's amazing. You know, that's such a big plus. When you said you have your lab work and I have it here, it's like, hallelujah, really? I get my own lab work and look at it together. I mean, really, most of the time you got to wait till you see the doctor face to face, and you don't have the benefit of having a copy of your lab work until you get there. So that's a huge plus for me, the way I look at it. And if there is an emergency, Dr. Haynes, something happens, what is the process, all right?
Well, the process for an emergency is to get emergency help. So, you know, if ever there's something when you're having chest pain, you're having shortness of breath, you know, I don't actually want you to call me. I want you to go and get help immediately. So that's a time when you know, go to the emergency room and follow up with me. Let me know what's happening. But definitely, we want to still treat emergencies as emergencies, and I don't want you waiting for your virtual visits or talking to me if you're actually having an emergency.
Right. So go through the 911 way or straight into the emergency room.
Right. Exactly.
All right. What does 2016 look like in the way of being in compliance with the new Health Care Affordability Act, or as it's called, the Obamacare, for business owners? Because I know we mentioned before, it has to be a specific number of employees if it's under XYZ or over. To me, sometimes even in speaking to other business owners that I know, it gets a little blurry, that line gets a little blurry, and then there's talk that some premiums may be increasing for 2016, which I think going your DPC way, it answers a lot of, or actually goes for the heart of many of the problems that business owners are encountering. But what would that look like by 2016, in your opinion?
Well, so this year, business owners had more than 100 were affected. And in 2016, we know that that's dropping down to business owners with more than 50 full-time equivalents. So, there's more in business owners who are being affected and who are going to have to look for, first they have to decide if they want to be compliant or not, because if they're not compliant, the penalty is $2,000 per employee, and that's for the employees that you have that are, kind of the first 30 are kind of waived, so it's after the first 30. So, there are some businesses who are kind of looking at it from just a financial standpoint, and are making a decision whether or not they're going to be compliant or not. For businesses that do want to be compliant, they would need to be looking for those minimal essential coverage type of plans, so that they have something. And those are going to be the plans that are less expensive, kind of the bronze plans that we were talking about earlier. Mm-hmm. And there's a lot of insurance brokers, and I am not one, but there's a lot of brokers who can kind of give you resources to that could kind of help you to find that, because even then there are some options that are available. And so those are really some of the things that are coming down our way. As far as premiums go, everyone is predicting those to go up, and as we're seeing all of this kind of merger madness, we know that typically, when there's less competition, and there's already not a lot of competition, that those premiums are more than likely going to increase, and it's really going to force employers and everyone to be a lot more creative about getting their needs met. And so I think that is one of the reasons that direct primary care is seeing such an explosion of interest, because it's gotten to that phase of being almost ridiculous. So people are really looking at ways that they can decrease their healthcare spend and really increase the value, because I think the worst thing is looking at how much you're spending on your health insurance and then thinking about, okay, what am I actually getting for those healthcare dollars?
Absolutely. Yeah, that makes so much sense. So when it comes to questions of compliance, then the business owner has to go speak with an health insurance broker, and this is not a conversation, this is not a Dr. Haynes question to be asked, though it can be raised, but the point would be that it is the business of the business owner to find on their own and to go to insurance brokers to find out regarding compliance and or not, right?
Absolutely. And if you're having any difficulty, or if your broker isn't really giving you a lot of options, then we do have. I know some brokers who are a lot better versed with direct primary care and finding ways to kind of create those wraparound services. So I'm obviously I'm not a broker, not particularly interested in becoming one, but I'm a patient advocate. I like to really advocate for my patients, so it's an area that I've looked into. And even on our website, if you go to where it says the frequently asked questions, one of the questions at the bottom is, that we get a lot is, can you recommend an insurance product to go along with this? And I don't make any recommendations because I'm not a broker, but I do mention some some resources for both for businesses and then also for individuals, because individuals actually have some other options that are also worth exploring.
Excellent. Dr. Haynes, thank you so very much for your time and for explaining some of these questions, or most of my questions anyways, and all of the points that you have put on your slides. They have been quite enlightening. If you don't mind, can you repeat again the telephone number where business owners and individuals alike can reach you, and the name of them again?
Mm-hmm. So the phone number is 386-868-0247, and that takes you directly to our Healthy Employees Relationship Specialist, and we can kind of sit down with you and really kind of look at your options. And then the email is healthyemployees@familyfirsthealthcenter.com.
Is it possible for employees to meet you in person before they sign up?
Absolutely. So, and we actually we encourage that. So if someone wants to come in, we recommend having like a meet and greet. And when we're working with an employer, oftentimes that will actually happen at the business. So if that employer has a kind of a space or kind of a break room that is large enough where we can all kind of come together, I enjoy kind of coming in and introducing myself, letting them know how much I'd love to be their doctor, and just taking the time to kind of establish that rapport and let people know kind of who I am beforehand. And then they're always welcome to also come in for a meet and greet, and they can schedule that online at our website or just call us. And my team loves to give tours. So, people come in and they'll get, a tour of the office. They get a little goodie bag, and they get to meet me and meet my entire team. So that's definitely, we've got people who, sometimes feel comfortable going ahead and signing up without actually meeting us in person. And then we've got other people who want to kind of come in and, shake our hand and have a conversation. And that's great, and we encourage that.
Okay, great. So
it's actually extremely easy to make an appointment. You can call the office, and actually I could really easily probably just show you. If you go to our website, so this is our actual kind of live website, and if you scroll down, you'll see right here where it says, online appointment scheduling, and when you click there, you get this screen, and it shows what appointments are available. So you could make an appointment for Monday at 11:30 if you're still inclined, regardless of whether you're a new patient or you would be an existing patient. So we've really tried to make it really easy for people to kind of interact with us and kind of get everything that they need answered. And this section here is that frequently asked questions section that I was talking about earlier. And a lot of the questions that we get, we go ahead and we will put the answers to it directly on our page. So there's no question. It's completely out in the open and transparent. which is just the way that really that medicine really should be. So kind of to answer that question, it's just it's really important. And really easy and simple for someone to make an appointment, whether they want to make a virtual appointment or they want to do one where they actually come into the office.
Thank you, Dr. Haynes, for such a good presentation.
Well, thank you, and we just really like to continue the conversation and help you kind of crunch those numbers and explore opportunities to work together. So, thank you again for being on with us, and we hope to meet you soon.
Okay, have a good afternoon.
You too. Bye-bye.